The funding for this program is provided by the Corporation for Public Broadcasting and the Friends of 4, 10, and 12.
We have the right to go to the VA. We, as veterans who served our country, who didn't run away, who went and fought, and yet we're being turned away, we're being denied certain medical treatments.
Idaho veterans are angry and confused about recent service cutbacks at Boise's Veterans Administration Hospital. That's our story tonight. Good evening. An audit team from the Veterans Administration arrived in Boise yesterday to begin a 3-day review of the operations at Boise's Veterans Administration Hospital. That review was requested last month by Idaho Republican Congressman Larry Craig in response to a reported $500,000 budget deficit at the Boise Hospital. That deficit has in turn prompted cuts in services to many Idaho veterans. In many ways, those service reductions make veterans just the latest group to feel the effects of a rapidly growing demand for federally assisted medical care, a demand that, needless to say, the government is having a good deal of trouble keeping up with. Many veterans see these cutbacks as, in a way, a broken promise, a promise the government made to them when they signed up for military duty. This story also raises big questions about the VA's long-term ability to provide the medical care that many veterans now consider a right. We'll be talking in a moment with the director of the Veterans Administration Hospital in Boise, with an aide to Congressman Craig, and with 2 men who represent Idaho veterans. But first, some additional background on this story from producer Gary Richardson.
The Veterans Administration Medical Center in Boise serves some 70,000 Idaho and Eastern Oregon veterans. Several times in recent years, fiscal problems at the center have made headlines around the state. 3 years ago, the Idaho Statesman reported plans to close the facility due to national VA budget cuts. But those reports were denied the next day by VA officials in Washington. In 1982, hospital employees charged Administrator James Goff with misuse of funds, citing, among other things, Goff's authorizing a free lunch for Congressman Larry Craig and Mountain Home Air Force officers touring the center. According to Goff, an audit conducted by the VA Inspector General's office turned up no irregularities on his part. More recently, veterans officials have expressed alarm over reports of rapidly growing demands for medical services, especially among the increasing numbers of older veterans. Traditionally, the VA has dispensed free medication and treatment to virtually any veteran seeking them, regardless of whether his problem was service-connected or not. The VA Medical Center in Boise sees about 150 outpatients each day, nearly a third of them walk-ins without appointments.
I came back from Vietnam and had a lot of really bad experiences. One of my best experiences was with the VA hospital. I was stone broke, I didn't have any money. I got hauled in there in an ambulance a couple of times, and they always took care of me. And that really bothers me that now they're talking that a guy that was in my position then now can't do that. So where is he supposed to go when he gets in a motorcycle wreck, or if he gets hurt or he gets seriously ill or crippled? He has no place to turn to. The only thing that he's ever known that he's really contributed to is the defense of this country. Well, I feel like the defense of this country owes him the right to medical care if he needs it.
In April of this year, citing a $500,000 budget shortfall at the Boise Center, VA officials said they were cutting back benefits to veterans with non-service connected ailments. The announcement stirred anger and confusion among many Idaho veterans. Residents of the Idaho Veterans Home were among the first to react.
I wrote the original letter on April 25, which was signed by a vast majority of the members of the home, including many service-connected veterans who are not affected by this, but who think it is unfair.
It's kind of a shame that they do something like that, for the simple fact that we as veterans were there when they needed us, and it just seems that the VA is going back on its word towards us for being there when we need them.
I am a service-connected Vietnam veteran, and there was an incident not more than 2 or 3 weeks ago where I was denied some initial treatment for my Agent Orange. And all I needed was just the proper medicine, the detergent, soap, and everything else I need to wash with. And I ended up having to go to a doctor in the mental health center to obtain the prescription. Because I don't think they really, let's say, counseled their some of the staff employees on who is eligible, who wasn't, you know, etc.
Getting past that front desk, it's like they've got a screen up there to keep you out.
I went in for a service-connected emergency the other day, and I was told my appointment for my service connection won't be until August 30th. So if this is part of their policy on cutting back, they're now even messing with service connections, as far as I'm concerned.
Have you ever been notified of the change in policy?
No, just hearing it, going over there, going through the procedure is the only time you find out about it. As a matter of fact, a lot of guys that I have talked to over there have come from Burley, Rupert, you know, Twin Falls, Idaho Falls, to find out that they're no longer qualified for treatment, and they don't know what to do.
While many of the veterans we talked to were critical specifically of the changes here at the Boise Center, they were also fearful that these policy changes might be the beginning of a national trend.
Once they get the non-service connected vets cut, then there's going to be a next step, if we let them get away with it. And that is to take, the next step may be, say, veterans with 30% disability or less, then they're going to cut them off. And once they get that through, then where are they going? The Veterans Administration hospitals have proved that they can treat these veterans at less of a cost than the private sector. So if you want to save money, it would be far better to treat these veterans at the VA hospital.
Eastern Idaho veterans who must go to the Salt Lake City VA hospital for treatment voice similar concerns.
If these guys have no insurance or no money, they have no other recourse. The veteran has no other recourse than the veterans hospital. And if they're going to cut these things out for the veteran, I can see a large scale of problems all over the country because people won't be able to afford medical care any other way.
Veterans don't all stick together and do something about it. One of these days we're not going to have no benefits or no VA hospitals.
In mid-May, saying the budget difficulties at the Boise VA Center began 6 years ago, Idaho's 1st District Congressman Larry Craig called for an audit and operations review. A team appointed by the Veterans Administration arrived here Wednesday to begin a 3-day audit. Dr. John Ditzler, administrator of the Veterans Hospital in San Diego, heads the review team. He explained the purpose of the team's visit.
My purpose here is to serve in a consultant capacity to the regional medical director and the chief medical director in Washington. As such, I'm reviewing quality of care issues as they relate to budget matters. We have no particular questions about the quality of care, but we need to know how their projections for the future relate to the current budgeting for Boise.
Are there general budget problems in the VA nationwide at this point?
Nationwide, we survive by being tight-nosed about eligibility and by suggesting priorities in order of care. Our problem is not so much today as it's going to be in a year, 2 or 5 years when the aging population becomes a major issue.
More on this story now with the director of the Boise Veterans Administration Medical Center, James Goff. Mr. Goff, there apparently is a great deal of confusion over this new policy. Would you just take a moment and explain it for me briefly?
I'll try to. Let me start by saying that this troubles me as a Vietnam veteran as much as it does the veterans who we just heard. Basically, the policy is the VA national policy that the VA was set up for entitlement to care for certain veterans, those who are service-connected. The law says that beyond that, we can use the resources available as far as they will go to treat non-service connected veterans. When those resources are not available...
Let me just interrupt you for just a second to clarify that service-connected means an injury that a
It means that,
veteran sustained while he was in the military.
yes, it means he has a medical condition that has been related to his experience in the military.
Go ahead, I'm sorry to
It may
interrupt.
be an injury, it may be a disease.
Right.
And the fact that the resources can only be used for non-service connected veterans as far as resources will allow mandates that when we run out of money, space, facilities, that the non-service connected veterans treatment must be the first to go in the priority of things.
And that's exactly what's happened at your hospital.
That's exactly what's happened at our hospital and at a majority of hospitals in the country to some extent. The Spokane VA Medical Center has taken it a step farther than we have and is excluding some of the non-service connected conditions of people who are service connected less than 50%. As was mentioned on the tape, the Salt Lake VA Medical Center is doing much the same as we are. Now, there are certain non-service connected veterans who are still eligible for care. Those are ex-prisoners of war, World War I veterans, prisoners on aid and attendance, or who have been adjudicated and have a pension, who have been exposed to Agent Orange and are on our register, or who have been exposed to the nuclear testing during World War II. Those people have a higher priority than a non-service connected veteran who does not fall into one of those categories. And I want to make one other point, and this is most important because there was an error in what we just saw. A veteran who needs to be in the hospital is still eligible regardless of whether he is service connected or not. The only program we are impacting is our outpatient program for those who can be treated as ambulatory patients. If they need to be in a bed, we'll take care of them.
What about the fellow on the tape? I'm not expecting you to be up to speed on each one of these cases, but he said that he was denied help when he showed up at your hospital for an Agent Orange related case.
As you said, I am not familiar with his specific case, and I would have to look into the circumstances surrounding it. We do over 50,000 outpatient visits a year at that hospital. It's possible that we make a couple of mistakes during the year in doing that, although I would like to get the details.
The other fellow who said his appointment for a service-related injury was scheduled not until August 30th.
That's very possible. Many of our clinics are scheduled up through August right now because of the heavy demand on our staff, and there just isn't clinic time before that.
I see.
It indicates to me that he doesn't have an emergent or urgent problem, because if he did, he would be seen now. And by the way, any veteran who comes in there right now, service connected or not, if they have a problem that needs immediate attention, whether it's outpatient or inpatient, they're going to get the attention. They will be looked at, triaged, and only told to go seek care elsewhere if they're in a stable condition and their problem is not immediate.
Just let me ask you finally, Mr. Goff, about why there has been so much confusion about this. Some of these fellows tell Gary Richardson that they can't find out what the policy really is. They can't find anything in writing. Why has there been so much confusion?
The policy is very difficult to put in writing, as you can tell by the explanation I've just given you. There is, in the midst of all this, still a medical judgment to be made on each individual case. The physician is the final adjudicator as to whether or not a veteran is going to get treated. If that physician believes that that veteran needs treatment and can't get it anywhere else and it's going to jeopardize his health, then that veteran is going to get taken care of, even under the current policy.
We'll come back, sir. Thank you. Veterans groups have generally reacted negatively to the policy changes at the Boise Hospital. We go now to two men who know how some local veterans are feeling about this situation. Gary Bermasolo is the administrator of the State Division of Veterans Affairs. He is a Vietnam veteran. And Tom Niehoff is the National Services Officer for the Disabled American Veterans in Idaho. He's also a Vietnam veteran. Mr. Bermasolo, you've just heard Mr. Goff's explanation of this policy. Do you still have questions, concerns, criticisms?
Well, we have a number of questions and concerns. I'd like to point out at the onset, however, that our difficulty doesn't lie necessarily with Mr. Goff and the way our VMC is operated. We have a very high level of care. As one of the social workers that I work with pointed out the other day, we're beating up the messenger because we don't like the message that he's carrying. And it's true, we don't like the message. The national office, the central office of VA, obviously has short-funded our VAMC. We have a $500,000 deficit here, and that's put Mr. Goff in the position of having to implement some policies that are not popular, either with the veteran population or with Mr. Goff or myself. The problem, as I see it, exists in that there is an inconsistency from hospital to hospital within the VA structure in terms of how the veterans are treated. And this is particularly true when there is a different level of funding. In other words, one hospital may have adequate funding to meet their needs, to provide their level of care throughout the year, while another one would not. And so a veteran who is currently receiving good quality care, non-service connected, in one particular hospital could now come to the Boise area and indeed be refused care that he's been accustomed to receiving in another area. And I think that that's a big problem, and it's one that needs to be addressed nationally.
Mr. Niehoff, how about your concerns?
Well, our concern is the fact that Washington, D.C. does not seem to recognize the problems that we have here in the Boise area as far as the impact with the distance traveled by a lot of the veterans, the number of veterans for such a supposedly small state, and due to these cutbacks that Mr. Goff has been ordered to implement, we're concerned that the non-service connected veteran who has an acute disease that requires life support or life-sustaining drugs is being turned away and he has nowhere else to go. Legally, the VA may be correct in doing this. Morally and ethically, I think they're very incorrect.
Are those cases happening?
Yes, we've had a few which we have reported to Mr. Goff. His office has been very helpful in straightening out those cases. The Vietnam veterans, such as the one who was turned away, that was straightened out this morning. He came back in and was seen this morning and treated. The problem there was a breakdown between the management level of the VA to that clerk that sees the veteran. You see, when you go for admissions, you have to go through a clerk before you see that doctor that makes that medical judgment. And if that clerk does not clearly understand the procedure, they're going to be the ones that the veterans is running up against in that wall that he mentioned.
I hear what you're saying. Mr. Bermasolo, do you know cases where this is happening, where veterans who, even under this new policy perhaps, should receive care, but for confusion or a bureaucratic snafu or whatever are not getting that care?
At this particular time, I do not. The policy has been in effect for just over a month, and it has not been my experience that there has been anyone, at least at the Veterans Home, who has not received the care that they needed.
But a lot of those veterans are worried that that might happen.
Exactly, and it's a fear of the unknown, and I think a good part of that is because the only thing they really know about the cuts is what they've read in the media, in the paper. There has been nothing in writing. I haven't been able to post a policy for them to read because, as it's been pointed out, it's not cut and dried. It's a very complex issue. They're afraid of what might happen in the future.
Same thing you're hearing, Mr. Niehoff?
Oh, yes, definitely.
Okay, well, let me go back just briefly to Mr. Goff on one of these points. Are there some, you've had some problems sorting out this policy, no doubt?
That is correct, yes.
But how would you characterize the situation as we sit here tonight?
I think we're starting to get all the members of the team functioning off the same sheet of music. As we implemented this policy, it was our intention initially to do things a little differently than we ended up doing them, and that created some confusion among our staff and among the veterans because we had counseled the veterans. We had even met with the congressional staffers on it, so they would be aware. As we implemented the policy as it now exists, we had to do it quickly to have the maximum budget impact and cost containment. And it did create some misunderstandings in the beginning. There's no question about that.
Mr. Niehoff, just so I understand completely here, you don't have specific gripes with Mr. Goff and the way he runs his hospital as much as you have with the Veterans Administration nationally and their policy in this regard.
Oh, that's definitely correct. The VA hospital, especially in Boise, has been known to go the extra mile with the staff on a veteran. Many veterans in eastern Idaho would rather come to Boise than go down to Salt Lake City because they get better treatment here.
Okay, we'll come back in just a moment. I indicated earlier that Idaho Congressman Larry Craig requested the operations review of the Boise Hospital, which is underway as of today. Carmen Larson heads the Congressman's Idaho office. Ms. Larson, why did the Congressman want this audit, and what did he hope to find?
Well, he wanted the audit because of this unusual circumstance of ceasing care that had been given in the past. And he would like to know why that has happened. Obviously, the first thing is there's a deficit. That's why it's happened. But why is the deficit there? And the congressman feels there could be any number of reasons why that is so. That the National VA has not adequately funded Boise is one distinct possibility because of making it a teaching hospital, but for budget purposes, not making it an affiliated teaching hospital and thereby giving it less funding. By giving them what they call just the throw-in money. At the end of the year, you have trouble, here's some money. Not giving them reoccurring funds that they can depend on for planning from year to year. Another possibility is that there has been quite a lot of expansion at the Veterans Hospital in the last few years. They have a geothermal project, a nursing bed project, my mind goes blank, alcohol rehabilitation, animal research.
You're suggesting that some of that expansion might not have been justified?
No, I'm not, and I don't think the congressman is either.
Just that it's a cost that...
But the cost for each individual item is covered, obviously, by funding they get for this specific purpose, but what may not have been looked at, and I can't say that, Mr. Goff might be able to better than I, is that each one of those things requires additional staff assistance.
Sure.
And a cost that then becomes reoccurring in another part of the budget. We think that care for the veteran has to come first. The congressman's very concerned about this and would like to see why. When we know why, we can say, well, then what needs to be done?
Are you concerned that there are some Idaho veterans who perhaps really deserve the care and perhaps even deserve the care under this new policy who are not now getting it?
Well, I think there have been some cases, and we've discussed those with Tom Niehoff from the DAV and some of the others. As I understand it, they have gotten those mostly straightened out. In the last couple of days, we had written a letter to Mr. Goff so that it would be on record requesting reasons for why certain veterans had not been treated who met all service-connected reasons and met all definitions in the letter that he sent to us.
Okay. Well, let me open this up and invite you all to get back in on any of these points. But let me go back to Mr. Bermasolo first on this question of the audit. I understand both of you gentlemen met with the audit team today, right? Are they looking at the right things?
That's difficult, really, for me to respond to because I haven't had an opportunity to look at what they're reviewing. When we sat down and talked with them, they were primarily concerned with the way the policy had been implemented and how it had come down. And our relationship, our ongoing relationship with the hospital, which has been pretty good. So as far as what they're doing in terms of the book work, the actual audit work, I can't respond to that.
Mr. Niehoff?
Quite frankly, he didn't even bring up what areas they were looking into. He didn't even mention. The only thing he did was introduce the gentleman from Washington, D.C., who is the accountant or auditor.
Well, I would assume that it's the view of both of you that this hospital is underfunded in relation to the needs that it must meet. Right?
Definitely.
Yeah. It was pointed out to us just recently, both Tom and I think, that on a national level, the VA doesn't have a problem with the amount of dollars that they were funded for this year. But however, in the allocation process, as Carmen pointed out, there's been some errors made. We've been underfunded here in Boise, Idaho, and as a result of it, we have veterans that are suffering as a result.
I would say in that regard that at least our information shows that in Idaho we're spending about $175 per veteran per year for care, while in Oregon they're paying $240 and in Washington $250, and that does seem to be a discrepancy. Another thing that we want to look at.
Is that the bottom line here, Mr. Goff, that this hospital has just been underfunded?
Well, if you want a yes or no answer, I would have to say yes. The reasons that Carmen gave, this hospital has emerged from 10 years ago, basically a long-term care facility that did very little acute care, to a fully acute general medical, surgical, and psychiatric healthcare institution that is respected in the medical community, is a teaching hospital with the medical school in Seattle, and treats patients who are really sick. And I could give you anecdotes of nurses coming from other intensive care units and working in hours and being amazed at how sick our patients are compared to patients they were caring for elsewhere. And this, it isn't that we've added beds. We have the same number of beds we had before. We have doubled the number of outpatient visits we're doing over that period of time. We have reduced the average length of stay from about 23 days to 11 days, and that includes everything, psychiatry and alcohol treatment and geriatrics and the whole works. We have gone into the teaching programs. A veteran can come to that hospital now and get as good a care as he's going to get in Idaho.
I said doctors in the community seem to agree with that. The congressman met with 6 doctors, both VA and private doctors, head of the medical association here, and they were very gave a lot of praise to the
But
Veterans
that costs
Hospital.
money
Sure.
to do that.
I have just a couple minutes left, but let me raise this question. If we're having this much difficulty when the Veterans Administration, as Mr. Bermasolo says nationally, says it is properly funded, isn't this problem just going to sort of progressively get worse, not just in Boise, Idaho, but all over the country as the age of these veterans increases and we have an aging population of veterans?
Right. Well, I should imagine the expenses would go up extravagantly based on that. However, if you're going to look at the VA nationally and say where they're spending their money, maybe their different priorities need to be set there. But when we ask them for Idaho, we feel that we have to have concrete information like this audit to base it on. We can't just go and be one of 500 who say we need more for our area.
The problem is going to get worse, though, as the doctor on the videotape indicated, over the next 2 to 5 years as people grow older, right?
As I understand it, we currently have 4 million veterans in the United States over age 65. In 7.5 years, that number is going to go to 9 million.
That's correct.
That is scary. I share these people's fear about the unknown, or of the unknown, because I fear that this is only chapter 1 of a long, sorrowful book.
We are in an area of growth. Many VA medical centers are in an area where populations are declining. The VA budget mechanism has been not well designed to shift money quickly to where the need is as the need shifts, as demographics shifts and needs shift. And that system, it responds too slow.
Well, I'm sorry we're out of time. We'll have to leave it there. Mr. Goff and Ms. Larson, we thank you for joining us tonight very much. Mr. Niehoff and Mr. Bermasolo, thank you, gentlemen. That's our time for tonight. We'll be back here tomorrow. I'm Mark Johnson. Good night.
The funding for this program is provided by the Corporation for Public Broadcasting and the Friends of 4, 10, and 12.